I'm just like, aesthetically speaking. Start now.
All right. Welcome to the very first episode of Aesthetically Speaking, the podcast where we're going to break down some of the science, real life results behind some of your favorite aesthetic treatments, but all in a super casual way, conversational, easy to follow, whether you're a skincare professional or just someone who is curious about what's out there. I'm Andrew Licio. I am a registered nurse. I have been in aesthetics for the last 10 years. I train medical providers and their staff across the country on how to use a number of different devices, specifically lasers. I love me some lasers. So I wanted to kick off this podcast with exactly that kind of conversation. And I wish I had that when I was first getting into aesthetics, something that's informative, but without being too clinical where it went over my head, but without skimping on the facts. So to help me today, I'm joined by my good friend, clinical educator, and all-around aesthetics pro, Carissa McCormack. Yay!
Hello.
Hey,
Thank you
hi.
so much for having me. I
Of
love that I'm
course.
like the maiden voyage of this.
Right?
It's great.
So, Carissa, you have spent years training providers across the country on how to safely, successfully perform treatments, including our topic of the day today, which is CO2 lasers and laser resurfacing treatments.
Yeah.
So today we're going to pull back the curtain a little bit on what CO2 really is, who it's for, what it feels like, and what both providers and patients kind of need to know before diving in. So again, whether you're a professional looking to sharpen skills or just somebody wondering if CO2 might be your ticket to smoother, brighter skin, this is the episode for you. And Carissa, you actually just had one the other day.
Yes, I did. I am nice and red and a little bit crunchy, but I'm happy about it. And it was
Awesome.
provided by my favorite provider, Andrew Licio.
Well, thank you. Yes, you made the trek from New York to come see me. So the reason why I kind of wanted to start with CO2 is because it's been such a hot topic right now. I mean, I've been seeing it all over Instagram, TV. I've actually seen good and bad stuff, So I think that it was a nice kind of just jump right in to see what people kind of are saying about it, but also what we can do to kind of help people in educating both patients and providers so they kind of know exactly what to expect, right?
Yep. Sounds like a plan. I like
So,
it.
real fast, can you just give a little background on you, what your experience has been, as well as like any experience training providers on CO2 across the country?
Yeah, sure. So I started back in lasers in 2003. I was very fortunate to work with a doctor who had a lot of devices, which was pretty unusual for the time. And she trained me. And then in 2005, I was actually asked to be a clinical trainer for a laser manufacturer. It just so happened that that manufacturer came out with one of the first fractional CO2 lasers. So I kind of got thrown into the deep end pretty early on. So I've been a clinical trainer for the last 20 years, and I'm old, but I've seen a lot of things come and go. And it's really been interesting because CO2 is and has been the gold standard when it came to laser treatments. I mean, that was kind of one of the first things that was used cosmetically as well as medically, but medically first, then cosmetically. And then it kind of went away because everyone had this conception that you blew off all your skin with it. You're going to look like a burn victim for months. You'll have a line of demarcation along your jaw. It just wasn't, it didn't fit. And then when they came out with something called fractional CO2, what they did is they took this big laser beam and they broke it up into a bunch of little micro beams. So what would happen is you would have much less downtime. And then it kind of got a new, life in it, basically. So I'd say from the mid 2005 to maybe 2010, it was really, really popular. Then a host of other lasers came out. I mean, lasers exploded around then. And there were people saying, well, we have one that does the same thing, but it doesn't have any downtime. And we all know if it sounds too good to be true, it is.
Right.
But it
Especially
got,
in this industry.
yeah. So kind of got pushed away for a while. And then I found actually during the pandemic around the end of 2020, 2021, when medical offices were opening back up, the company I work for was selling a lot of CO2s. And I thought, what the heck is going on? I don't understand why this is so popular right now. But a lot of the dermatologists and plastic surgeons were like, well, we're open. Our patients are not going into the office. They have time to have downtime. They want a bigger gun. They want a little bit more of an aggressive treatment. We want to do CO2. So what happened is you started seeing some of those more aggressive treatments, and then people started realizing we don't have to be super aggressive with this and still get really nice results. So I think really it's kind of like the gold standard is back, and
Well, and
that's
I
why it's
want to touch a
popular.
little bit too, just because you had mentioned it, that fractional versus fully ablative aspect of it.
Hmm.
So, like you said, like back in the day, people were doing these fully ablative treatments where, I mean, you literally took off all your skin and you had weeks and months of downtime. Whereas now it's fractionated. I don't even think that there are any new fully ablative lasers out there that I've seen.
No, I
But
mean,
that fractional laser that is like you said, it's like breaking down that beam into little mini baby beams. Essentially, you have these like areas of healthy skin in between the areas of injured skin, so you heal a lot quicker without all the downtime, right?
yeah, correct. And I do occasionally have a doctor say, hey, how can I get a fully ablative laser out of this fractional laser? And I'm like, why do you want to? The whole point
Right, right.
is we don't want fully ablative. Now, there are applications. If you're removing, say, a skin cancer or something like that, there are different hand pieces that allow you to do that. But from a cosmetic perspective, I don't
Hmm.
think it makes sense to fully ablate anybody's skin ever.
I agree. Yeah, even when I go into a lot of trainings, I mean, people first question out of their mouth is like, "Can you show me a very aggressive treatment?" And I'm like, why do you want that? Because, I mean, one, part of what we're doing, I mean, after the age of 30, we're really not producing any collagen. So, as you're producing collagen now with any kind of aesthetic treatment, really, any kind of damage to our skin, we're producing collagen because our body wants to heal itself. So, that being said, like when we treat super aggressively, you're doing one treatment and yes, you have that collagen stimulation, but what are you going to do in the future to have that continue? So I always kind of tell them, look, like, especially when you have like those little old ladies with like paper mache skin that you're scared to touch.
Mm-hmm. Like it's going to rip
But
open.
right,
Yeah.
exactly.
Yeah.
So with them especially, you want to be a little bit more conservative because you don't want to penetrate too deep, especially with a CO2. You can get very deep and potentially go past where you actually want to go. So if you actually minimize that, go a little bit less aggressive and do multiple treatments over the course of a couple of years, I find that people have much better results. So they don't always want to hear that when I go in an office, but there's less complications, there's less issues, there's less
Hand
people,
holding.
yes, less hand holding with patients as far as like making sure that they're doing their home care. Yes, we always want to make sure that they do their home care, but you don't have to be so stressed about it, you know?
Yep, for sure. Now, there is no one magic bullet, just like there isn't necessarily one facelift. People always say, I want a one and done. And I'm like, yep, I want a vat that they can dip me in and pull me out and I'm 20 years old, but that's not going to happen right now.
Exactly.
So I feel like people really have to have realistic expectations, which we can talk about a little bit more from just a provider standpoint. There is no, if a patient comes in and they pull their cheeks back and they have no lines and they go, I want this from your laser, their expectations are not realistic. And you really should not be saying that they are. Yeah. So I think that is the biggest thing is first talking about, what does it actually do? And then what can you expect? And let's face it, you don't go to the gym one day and that's it and you're in shape.
Right.
You go
Right.
continuously. So this is an ongoing process. And can you look really great throughout your life? I think you can. I mean, look at what 80-year-olds, Jane Fonda's in her 80s. She looks pretty darn good. Now
Yeah.
she's had surgery. We know that, but that's not,
Right.
she also had to do some type of skincare. I do think that smaller steps equals a much larger sum in the
Yeah.
end.
I totally agree. If you had to explain CO2 to a patient in about 30 seconds, how would you describe it without scaring them?
Okay. I think I usually say to people, if you've ever heard of when you aerate a lawn, it's like you wear these weird shoes and they have spikes and they put little holes in the lawn, and then you sprinkle seeds in there, grass seeds, and the seeds grow and it thickens the grass. Now, I live in New York City, so most people look at me like, what's a lawn? And I get that. So just think of the laser as putting tiny little channels in your skin. And what happens is your body naturally wants to heal a small wound. It's going to go in there and not only regenerate more collagen, but it's going to take the collagen you have and sort of lay it out in a different way, remodel it so it may be smoother. So I think that the combination is you are remodeling the collagen you have, and then you're stimulating new collagen, which will lead to firmer, plumper, smoother skin.
One of my big things too is, especially when I go into an office, I always like to talk about targets within the skin that we're actually trying to be attracted to, essentially, when we're treating with laser. So in laser dermatology, for the most part, there are three, correct? We have our melanin or pigment, however you want to say that, oxyhemoglobin, deoxyhemoglobin, which is going to be our blood, and water. So water is going to be the target that we are trying to absorb that light into when we're using a CO2. Now, we have other lasers out there that are also attracted to water. So, I mean, you have the LaserMD Ultras of the world, the Moxies of the world, the Halos of the world, all of those. Some of them are non-ablative, some of them are ablative. What's the difference between ablative versus non-ablative?
Okay, so from just a pure practical standpoint, ablative lasers will vaporize tissue. So they get absorbed by water and they heat up that water so much that all of the tissue that contains water will become vapor. Whereas there are some that will coagulate. So what happens is they will absorb into water, but the temperature will not rise so high. And what you'll end up with is sort of I mean, I hate to use this analogy, but think about chicken. Cook it, it's,
Yeah.
before you cook it, it's a jelly. And then you cook it, it becomes firm. So that's coagulation. But what some of the lasers will do is they will actually cause more of a thermal spread and some heating that doesn't open up the tissue.
It's just essentially like you're injuring the tissue enough where the body says, hey, you need to stimulate collagen and elastin, and that tissue will essentially get eliminated out of the body once the body says, hey, you know what, this tissue is injured, go away. Whereas, like you said, with a CO2 or any ablative laser at that point, you're going to heat up the tissue so much that it vaporizes and you essentially have a hole, like those little aerated pockets that you were saying. Sometimes it's nice to have those non-ablative treatments in skin resurfacing where you don't have that same downtime, but are you going to get the same outcome? No, of course not. One is going to be a little bit more aggressive. Your ablative treatments are going to be more aggressive. So I tend to explain, same thing, like when we're talking about that, like water versus pigment versus blood type thing, people will say to me all the time, but that doesn't make sense because you said that you can treat pigment with a CO2, or you can treat pigment with a non-ablative laser like a Moxie or an Ultra or something like that. Right, you absolutely can, but the way that I describe it to people is, if you're drawn on a piece of paper, that piece of paper is your skin. Everything that you're drawing is pigment. The laser itself is that, and that beam is not attracted to that pigment that you're drawing. It's attracted to the actual paper. So if I take a hole puncher and start hole punching the paper, eventually the pigment's going to be gone because I'm essentially killing that tissue. So the more hole punches I make, the better it's going to be. Sometimes we're not trying to do a lot of hole punches. Sometimes we want fewer of them, but maybe they go a little bit deeper. And that's going to work a little bit better with those fine lines, wrinkles. And then as we resurface, which essentially more hole punches, right? That's going to be more of like surface pigmentation, surface texture, pore size, stuff like that. That also is going to come into play a little bit when you're deciding on how deep to treat or how aggressive to treat. And I think that that's a question too that even patients need to know when they go into a provider. Like, it's nice for them to ask, like, well, are you going to treat a little bit more aggressively for fine lines, wrinkles, or are we going to do more surface texture? Because I find anyway, correct me if I'm wrong, most of the time people have a little bit more downtime with a lot of surface resurfacing,
Correct. Yeah.
you know,
Yeah.
because it even though you're not going as deep, I feel like you get a little bit more scabby.
You totally do. I mean, but a lot of times if you're covering more surface area, so like more, acreage, you're going to have more downtime. I mean, if I take 80% of my skin and I cover it with a bunch of tiny little micro dots, I'm going to have 80% of my skin that needs to be replaced with new skin. So that'll take more time. If I have 5% of my skin with deep holes poked in, yeah, I may have some swelling, but the obvious, quote, downtime is going to be a lot less. So the one thing is if you're working on things like pigment, it's just a nice side effect to have when you do this resurfacing that the pigment comes off. Just like you said, you punch a bunch of holes, you lose all the pigment because you've just physically damaged that skin that gets thrown away.
So who do you think is like the ideal candidate for CO2?
I mean, it's hard to say because I think there's so many ways to use it now that you can use it on way like larger breadth of skin types and ages. Traditionally it was the very pale little old lady with wrinkles, like with vertical wrinkles in their skin, lip lines, that whole thing. But I think now it could be really anybody. You could do a light CO2 on someone in their 30s to get rid of sun damage, or you could do a little bit deeper, but not as many holes on somebody who's older, who's never had sun damage, but has some wrinkling to their skin. So, traditionally, I think it was the little white old lady. Now I think it's kind of a variety of skin tones and a variety of ages.
Now, that being said, though, when we do treat our darker skin types, we definitely have to be a little bit more careful still, even though when
sure.
it's fractional and you can treat a lot more people. When you treat darker patients, what's your go-to? Is it generally like just go less aggressive as far as depth of penetration or heat spread or all of that?
Yeah, I mean, so when we're talking about darker patients, we're talking, kind of that darker Mediterranean skin to as dark as you can get. Usually you want to pre-treat them with something that will help prevent hyperpigmentation. So if they have any kind of heat-based device on their skin, there's a chance that their melanocytes can hyperpigment and cause irregular patterns of pigmentation. So we don't want that. So I do think it's very important to pre-treat anybody with a darker skin type. And then yes, it's always going more superficially with not as much density, not as many holes is typically the way you will treat a darker skin type.
And now, like you said, you can kind of do all ages. What I find recently that I've been running into a lot is a lot of younger patients, because they see it online, that they're wanting to do these aggressive treatments. And I find that they end up looking worse when they do these aggressive treatments because their skin doesn't really need it. And they almost get that like waxy look to their skin. But I mean, I'm sure you've heard of these like very, very light treatments like an ecotone, a cool peel, things like that, where you're still doing what's considered an ablative treatment, even though you're not getting to the depths where you're hitting blood or anything like that, but they get really nice resurfacing and this really nice glow. So I do think that there is a space for, I don't want to say everyone, but your younger adults.
In a perfect world, yes, for us.
Exactly, yes. But your younger patients, but then you also have your middle-aged and your older patients as well. So I do think that, like you said, you do have this broad range of clients that you can see, but it's okay to say no. So I do have people that come in, like I said, that are younger, that are like, I saw this person from the Housewives get a CO2 treatment and her face was like crusting off. I want the same thing. And I'm like, absolutely not. You don't need that. But we could do this lighter treatment, which you'll have pretty much no downtime. You can have like a mild sandpapery feeling, So I do think that it's important to address why we can kind of treat everyone and who it's for. I mean, now would you treat somebody that has like severe acne or anything like that with the CO2? Because I do know that there's some of those non-ablative treatments that are attracted to water that people treat with acne and they get great results.
Yeah, that's a tricky one. Technically, you're not supposed to laser any type of skin infection. So if somebody comes in and they have a cold sore, it's not the time to laser that area. If they come in with cystic acne, any inflammation could really exacerbate that condition. It doesn't, to me, make sense necessarily to do a treatment on them. However, heat often will kill the bacteria causing acne. So you have people who say, well, yeah, I do these really aggressive treatments on people with acne. Look at them now. I want to know what they look like the week after.
Yeah.
And I think a lot of them maybe looked horrible, but they were okay with it. So you kind of have to have that conversation with your patient too and say, look, you may have a purging of whatever's going on. Are you okay with that? If they're not, lighter and more treatments will work better. So I'm a fan of getting things like acne under control. Never would I treat somebody with a cold sore. I think that's just crazy. But I think that there are ways to approach a lot of different skin conditions that we used to say, no, absolutely not. You can't treat them. So now I would like to point out, one thing, something like vitiligo, I personally am very nervous about because that's an autoimmune disease and inflammation of the tissue can cause the skin to depigment. And once that happens, it's a kind of a done deal until they come up with a cure for this. So that is one thing that I don't feel comfortable treating, though I'm sure there are plenty of providers out there that do.
It's one of those things where I feel like it's not indicated for that, and it's not indicated for that with a lot of lasers and a lot of treatments, but a lot of people do treat. So that's one thing. I do think that it's better to just get everything under control first, if possible, versus kind of going over that. Now, especially if you kind of have that angry skin to begin with, like any kind of breakouts or even certain autoimmune issues that will get exacerbated, even not by the laser itself, but your numbing cream, your post-care, because especially numbing cream can be very occlusive, can be very irritating, can kind of get stuck in pores if people don't get it off all the way. But also your post-care, like with you have to put an occlusive over top. Somebody that has breakouts, they're probably going to break out even more once you slather Vaseline or Aquaphor or some type of occlusive agent on top of that. So I think, like you said, it's really important to have that conversation with your patients and say, hey, this might happen, but I think it's a little bit more responsible to get things under control as best you can before those treatments happen.
Yeah. I think what happens is you often have a provider saying, oh, they want to do it now. I have to, strike while the iron's hot. And it's like, you know what? You can put them off. Just because you have this laser doesn't mean you have to use it today. Will you use it later? Yes. Will you have a host of people that you can use it for today? Absolutely. It's just don't try and make one size fit all. That's my only thing that I would say.
Speaking of that, I kind of want to make a little tangent for a little bit. Same thing with suntans and all year round. I feel like the more I am in this industry, the more I hear people saying that things are safe to do during the summer. Well, yes and no.
Yeah.
I mean, yes, the less aggressive you go, whether it's non-ablative or ablative, sure, you can do them in the summer, but you still can't be going out the next day.
Absolutely not.
You still have to be wearing your sunscreen or hat, sunglasses, like scarf, something like that to protect what you just did, because your skin is so much more sensitized to light, especially the sun, after a laser treatment. I don't care what laser treatment it is.
Sure. Hair removal doesn't matter. If you're red and you get sun on it, that red will turn brown, probably.
Yeah.
You'll have some type of hyperpigmentation.
So I always tell people, tan skin is injured skin. If we're injuring the skin more, we don't know what it's going to do. So you can hyperpigment, you can hypopigment, which is even worse. That's when the pigment is basically taken out of the skin because it worked too well or it's too injured at that point. And then people are walking around with like white circles on their skin that don't go away. They could go away, obviously, but I mean,
Yeah.
worst case scenario is it's permanent. So always just err on the side of caution. And like you said, it's okay to kind of put things off a little bit. So if somebody is overly tan or they're going on vacation or they have a really bad acne breakout, it's okay to schedule a little bit later. I think the patient's going to respect you more
Mm-hmm. Yep.
if you do that.
The other end of it too is then you'll have the other side and you'll have a provider go, well, why did I buy this? I can't use it for, 4 months out of the year because it's summertime. And my answer to that is, well, they do these treatments in, the Caribbean and South America and Miami
Yeah.
where it's beautiful and sunny all the time. You just have to prepare your patients. You can't
Right.
let them go out on the beach and get a sunburn and then show up and be like, hey, I'm here for my laser. I mean, you have to have that conversation about what it means to have healthy skin. And I do find when people start doing treatments, they tend to take care of their skin more and get less sun on it, which I think is great. And myself included. I mean, look, I grew up very much in the 80s and fried my skin. And I'm so grateful for lasers to reverse a lot of that damage. But I also found that once I started doing them, the less I wanted to get sun irresponsibly. The more I was likely to wear sunscreen every day and, wear a hat and all that. So I think it's a
Yeah.
good thing in the big scheme. It's just there's kind of like a shift of how you look at it when it comes to how people are going to do these treatments year round and how you prepare them for it.
Totally. I was one of those because I was a child of the 90s and early 2000s.
It's a
And
baby.
but I literally went tanning every single day in a tanning bed after high school.
100%.
Like after
I
school.
mean,
And that was like,
ugh,
that's what we did.
yeah.
And it wasn't until I was probably in my mid 20s at the time. And I was getting like brown spots on my face. And I was like, what the heck? Because I had never had that before. I just always got like a nice brown tan.
Yeah.
And now, luckily, like you said, I'm so grateful for the technology that we have and the skincare that we have and the treatments that we have, because people tell me all the time what good skin I have, but it was never like that. I always went tanning because I had acne up until I was 20 years old. And the only way I could quote unquote get rid of it was by going tanning.
Yep.
Which, had I known, I would have stopped long before and may have switched up my skincare instead of using Irish Spring or Proactive or something like that.
On that note, too, people always are like, but the sun dries up my acne. And I'm like, how does it look about a month after the summer? And they're like, oh, it's horrible. I'm like, yep, it's going to make it so much worse when you stop being in the sun, because your skin is basically not, your skin goes into an injured mode. So it doesn't turn over as quickly. And you still have this oil brewing under the surface and all this dead stuff on the surface. And you end up with worse breakouts about a month later. So I'm always like, please don't do it. Please.
Yeah. Well, just in general, your post care is super important, but almost more importantly is your prep. Because healthy skin is going to give you better results whenever you do any kind of treatment, because if you don't have healthy skin, it's not going to heal well. So even when people don't have that routine, I don't need them to have some like crazy expensive regimen or anything like that. But at the end of the day, you need to prep your skin. But if you're using bar soap or something that's meant for your body or your hair or something like that, you're not going to be able to give your skin the nutrients that it needs, that when it does get injured, it's going to heal in a way that you want it to.
Yeah, well, you're stripping the natural microbiome of it when you're just using like a bar soap. And then if you're not replacing some type of hydration or protection to the skin with either, even just moisturizer. Yeah, your skin, think about it. It's just skin that's been compromised to begin with. And now we're going to laser it? Absolutely not.
Yeah.
You can't.
Now, I'm probably going to get in trouble for saying this from some people, but
I love it.
I was watching, right? You said stripping the skin. So it made me think of this. So when a couple weeks ago, I was watching Watch What Happened Lives with Andy Cohen, and the guest was Molly Sims. And Molly, I love you, but she was talking about how no one should ever get a CO2 treatment because it ruins your skin barrier for life. And I wanted to reach through the TV and be like, girl, shut up, because you have no idea what you're talking about. Now, that being said, yes, when you do a CO2 treatment, you are injuring that skin barrier, especially if you're doing a full field, fully ablative treatment. When it's fractionated, not as much. Are you still injuring that skin barrier? Sure. But that's why that pre-care and that post-care is so important, so you can repair the skin barrier and your body can repair the skin barrier.
Yeah, your body heals.
In a healthy way.
Your body will heal. And I would probably go on a limb and say perhaps she is coming out with a probiotic-based skincare line, because that
right?
just screams of that to me. But I do think you just have to look at it like, yes, if you do the right things, your body will actually heal and become stronger. It's just like when I brought up working out, you rip down muscle and it builds. That's how that works. So yeah, we're causing a slight injury, but we're waking our bodies back up and saying, hey, heal this and start working like you did when you were younger. But we do have to provide the right environment for it to heal and be better, not worse.
Right. Well, and to her defense, I guess I'll say, when people don't know what they're doing and they're doing too aggressive of treatments on people that are not good candidates, fine, sure. The people that are not going to follow proper home care, sure. But other than that, stay in your lane, Mom.
Yeah. We love you and all. However, no, I agree. I think you have to just, yes, you have to go to the right provider. Yes, you have to do your homework, but also have a realistic understanding of what's going on. And if you don't, ask questions. Don't just make a blanket statement and say, it does this X, because clearly there are many people who have benefited from it. So, yeah.
I want to slow things down a little bit. You just got your treatment on Saturday?
I did.
Yeah, Saturday. I want to talk a little bit about like what it's really like to get a treatment. We'll do a quick little step-by-step walkthrough of a session, how people make it a little bit more comfortable. Because, I mean, how would you say on a scale of 1 to 10, 10 being the most painful thing you've ever felt, how would you rate what we did on you?
God, 5, maybe at the worst. It was not.
At the worst, yeah.
And even then, that was like 3 shots, like 1 around my upper lip for sure, which is painful. Let's face it. I mean, you could pluck a hair out of your upper lip. It hurts, but overall it was really doable. It really was.
Nice. All right. Well, you're welcome.
Yes. Thank you.
But basically what happened was you came in, we took your pictures, nice clean face, and then we put some numbing cream on. I like to use, it's a 23% lidocaine, 7% tetracaine. And recently at the office, we've been adding a 2% phenylephrine. It almost gives like a cold kind of feeling. Did you like that?
I think I did. Yeah.
Yeah.
It was the one thing I've noticed is when you were taking it off, it was a little bit funny feeling, more so than the typical 23/7.
The cold, I guess.
But I think that's what it was. Who knows? Maybe it's just been a long time.
But that being said, we left that numbing cream on an hour, right? When you do, especially aggressive treatments, like a mild, like little like ecotone, cool peel, very superficial treatment. I mean, me and you have done with no numbing before.
For sure,
but
yeah.
That's the kind of thing you don't need to have like this. I don't even want to say aggressive, but aggressive numbing. But when we're doing a more aggressive treatment, that's when you really want to take the time and numb. So we numbed you. That was your first hour sitting there. And then we actually combined your treatments. We did the Lutronic ECO2 after we just concentrated around your eyes with the Cynosure Lutronic Mosaic 3D, which is their new laser that's out, which actually I'm loving, which also is attracted to water.
Correct. Yes.
So that's a 1550 wavelength. So you do have that water absorption, but it's considered non-ablative. But we specifically went around your eyes and mouth area with that. And then we did the CO2 over everything. So your full face and neck, including the areas that we had gone over. So that being said, during your treatment, we did use some cooling. Cooling helps, like a Zimmer chiller is going to help out a lot of times with discomfort. A question I get asked a lot is if can people have laughing gas, that Pronox or Nitronox? What do you think?
I mean, I'm not a fan personally. I just don't like how I feel. It made me very dizzy, but a lot of people love it. So, sure,
Yeah.
whatever gets you through it.
Yeah.
I don't think it was necessary. The cold air was huge. It just takes that little bit of a, because you get kind of like a point where it almost feels like a little needle-ish, and it just blunts that. It's so much nicer when there's cold air. Plus, I think it helps with inflammation and the swelling, honestly.
I agree. The cooling alone, just from the swelling and inflammation standpoint of it, is nice. But also, like Pronox and like any kind of gaseous type
Explosive?
numbing or
No,
numbing.
I'm kidding.
Yeah, exactly. Yes, no, absolutely. I
I
mean, they
thought of that.
shouldn't be like puffing on it the entire time.
Agreed.
I mean, you want to administer your puffs essentially, turn it off, and move it away just in case. For me, anyway, I'm a relatively fast treater, I guess you could
Mhm.
say. So I feel like if we just kind of work through it, that is not necessary. But I mean, at the end of the day, does it hurt? A
I mean,
little bit, you know?
there are definitely zingers. You feel some zingers. I will say, when you changed, we were using different spot sizes or like picture squares or circles, and the smaller ones were a lot more tolerable because they don't put down as many little micro beams. So you
Right.
were better off using that smaller spot, but doing it faster than trying to do a huge area at a time. And that's something that comes up a lot in trainings. People will say, well, can I use the biggest spot size available? And like, you can, but it's a lot more uncomfortable. So
Yeah. Right. The duration of that pulse as it
takes
gets
longer.
longer because it takes longer to go. So, I mean, most lasers work in milliseconds. So let's just say seconds. So it's a little bit more relatable. I mean, if you have a pulse that is 5 seconds long or takes 5 seconds long, I could do the exact same energy that we're doing and cause the exact same injury, but doing it over 1 second. And I just might have to do it
Five
a few more
times. Yeah.
times. Yeah,
It's not
exactly.
that bad.
So it's not that bad. And I mean, I find that, especially like you said, in trainings, that comes up so often. Sure, if people can tolerate it in certain areas, like the neck is a big one where it's not that painful. It doesn't hurt that much because you don't have as many pain receptors on your neck as you do in the middle of your face. Sure, bump up your spot size, get through it. But I mean, I find that you'll get through something so much faster and so much more tolerable. I mean, I was just treating somebody who actually is also your friend last week, and we did her actual eyelids. And it's very difficult to numb eyelids because
Yeah.
unless you're doing like a nerve block, which we don't really do, because you don't want to get numbing cream in somebody's eye.
Hmm.
That can cause like burns, lacerations, I mean, ultimately blindness. And so she really didn't have any numbing cream past her eyebrows. And we did a fairly high energy. And I treated right up to the lash line with her intraocular shields in. And she said it was like a 2.
Yeah.
I
She's a
mean, granted,
baller.
she's a trooper.
She's
Yeah,
amazing.
she's a trooper, but she said it was a 2. So, I mean, the fact that you can do that with such a small spot size and still get the same result and breeze through it and not have to stop or have somebody in so much pain, I think that's huge for people.
100%. I think, in fact, I think having it done that way, which I had never had it done that way,
Really?
changes the way I'll teach people. Because honestly, yeah,
You're
no,
welcome.
thank you. Thank you. Because honestly, I've always been like, yeah, you're fine. They're fine. Just keep going, And the reality is it doesn't take any longer to do small little dots, and it's so much more comfortable. It really is. So yeah, thank you.
Nice. You're welcome. So after we treated you, I did put like a cooling mask on. Now, I like one from Epicurus. I love that
Big
brand.
fan.
It's a biocellulose mask. There is an ingredient in it that is an anti-inflammatory, which is nice, and it is safe for a baby with an open wound. So, that being said, people ask me all the time what I use. There's a number of different product lines out there. I don't know every single one. I'm never going to know every single one. I always just tell people, ask whoever your skincare rep is, has it been tested with this type of laser? It doesn't have to necessarily be that brand, but I always tell people there's a couple things that you need to know about your laser, and one of them is your wavelength. So a CO2 is what, Carissa?
It is a 10,600 nanometer wavelength.
Exactly. So that being said, you can go to any skincare company and say, has this product been tested with a 10,600 nanometer wavelength laser? And if they say yes, knock yourself out.
Mm-hmm.
Other than that,
Don't do it.
I don't know what to use. Yeah.
Well, and I can tell you, I've used others that said, yep, absolutely, you can use them, and you put them on even after a non-ablative water targeting laser like an Ultra, and it burned. It was like, my gosh, take this thing off or else there's no way. So the Epicutis was great. You put it in the refrigerator beforehand too, which really made a big difference. So it was just lovely. And it took a lot of the redness out, I think.
Yeah. And one of the other things, so I'm not a huge fan of like loading up people's skin with stuff immediately after a treatment. Like I usually don't put an occlusive on immediately after. I like to wait until the heat kind of subsides. But the one other thing that I did put on you was exosomes from XOE. It's one of the first times that I've used that specific brand. I have used some in the past that I didn't really love, but you've been actually pretty vocal to me about your recovery afterwards. And I mean, we're only, this is day 4, day 3. Yeah, so 3 technically. I mean, you're barely red.
I have to tell you, I'm kind of in disbelief.
Like you're pink, but
I am in disbelief. And this is not a paid for advertisement, but I too have not been really wowed by exosomes. And then you get the people saying, well, we don't know where they're from. And what if, they carry some type of pathogen with them if they came from a human or if they, etc. So anyway, exosomes have been controversial. I do think that there's probably a place, but exosomes in general, I have not seen that they have caused a quicker healing time. This product actually uses plant-based exosomes, which I kind of went, huh? I didn't even know that was a thing. And they have something that you use 5 days prior, then you put on another one the day of, and then there's a repair. And I have to say, I usually am so red and so swollen from everything I do, from regular microneedling to even sometimes a true microderm where it's like with crystals. My skin will get red and puffy. I mean, I have pretty robust reaction, let's just say that. And this was a really surprisingly, in fact, I kind of went, gosh, maybe we should have gone stronger, with our treatment, though I knew I didn't want to. I was like, let's just do this and then we'll always do another one in 3 months or whatever.
Yeah.
Sorry, but you're on the hook for that. So, but it really made a big difference. I have to say, I don't know if it was just a fluke, but I'm definitely going to explore it more.
Yeah. Yeah. While it's not a paid ad, we'll definitely take some samples.
Yeah, guys. No, thank you. Big fan.
But like you said, you want to do probably another one in about 3 months. So like immediate versus long-term results. Yes. In the immediate, you're going to be a little pink. You could have that post-inflammatory erythema, which is like that mild pinkness, anywhere from like 3 all the way up to 6 months, especially on the people that tend to be a little bit more on the red side. But a lot of times people will have this misconception of, I got these amazing results, but it's really just a little bit of swelling.
Yeah. Yeah.
Now, sure, enjoy it. I mean, usually I find anyway, the more immediate stuff is going to be like a smoother surface of the skin, improvement in pore size, stuff like that, improvement in fine lines. Now, your more long-term stuff is, I think anyway, going to be more of like the tightening aspect of your skin because of the collagen stimulation. So it's going to look firmer, tighter, smoother, as well as improvements in deeper lines, deeper scars, stuff like that. But how would you say results build over time?
Yeah, it definitely takes time. I mean, I think you can see a change up to 6 months after a CO2. And, even with younger people, because I remember years and years ago, I had one done. I was in my I guess, late 30s. And I remember saying, like, yeah, my sun damage looks less because it took sort of that surface pigment away, but I didn't really see a huge change. Now, what was I going for at that age? Nothing miraculous. But about 6 months later, we did some after pictures and it was like, wow, that made a huge difference in the finer lines that were starting to develop at that point, as well as just texturally. I think my texturally, I can't say that, like my pores were better, etc. So I think that you do see a change, a thickening of the dermis over time, which does take time. The skin looks tighter and firmer and just looks nicer.
Yeah. Now, I mean, as far as like setting realistic expectations, I feel like that is one thing that everyone has a tough time with, but also patients they want like one treatment under $100. They only want to do it one time. And that's not really the case, especially with something like this. Like you said, like the improvements can come all the way up to 6 months, especially when you're doing a more aggressive treatment. But so if somebody wants like that airbrushed skin kind of result, how many treatments do you think that that's realistically going to take? Or what do you tell people, I should say?
I would,
Because everyone's different,
yeah.
obviously.
I mean, yeah, everyone's different, but I would say at least two, and they probably are going to be more aggressive treatments, those two treatments. So there is no one and done. Sorry, just not
Yeah.
going to happen.
Right. Yeah. Well, even with those really mild treatments where there's really no downtime, I mean, I tell people you're probably going to have to do one every 4 to 6 weeks and have like 4, maybe 5 treatments. Now, obviously, that's going to be a less expensive type treatment than the more aggressive ones because there's less prep, there's less post care, all of that kind of stuff. But I think it's important to note, depending on what you want for your downtime, that's going to impact how many treatments you essentially need.
Agreed. And it's not just up to, do you want the downtime? Because everyone's like, go big or go home. I
Right, I
want,
don't care,
I
yeah.
want the downtime. And then day 2, they're blowing you up going, oh, why am I still red? Why do I have, scabbiness? What's going on? And you're just
Yeah.
kind of like, you didn't really understand it. You have to really look at the person. And I would personally say always do something to get them ready, whether it's skincare or whether it's a lighter treatment, just to kind of see how their skin heals before you ever just jump right in and do a really aggressive treatment. I think that's where people get into trouble. Not to mention newer providers a lot of times aren't that skilled and they can make a real mess of their
Oh
skin.
God, tell me about
Yeah,
it.
because they're not, they're just not, it's like you're learning how to stack blocks and you're just not doing them as cleanly the first time as you do the 30th time you've done it. So from a provider standpoint, I really think people need to walk before they run and not try and jump right in and do these really crazy treatments. I'll always get a text saying, hey, look at this on Instagram. Why is the skin shrinking up and look so good as they're doing the laser? And I'm like, well, yep, you can do that. But I'd love to see this person 4 or 5 months from now, because I guarantee you they're covered with irregular pigmentation and potentially little squares all over their face. So you have to be really, you have to learn your craft. That's how I do.
I actually just talked to somebody about that at a training not too long ago because they had asked the same question. They showed me a video on Instagram and they said, well, how do I get that? And I said, look, like you can do things to make it look cool, but you don't need that one as the downtime because they're going to have horrible downtime with something like that. And usually what I find is every time they do that, it's always somebody that's holding the handpiece higher up than what it should be. So they're almost defocusing the beam and spreading that heat. And most of the time when you see those videos on Instagram or TikTok or something like that, you have like the white frosting, which is normal. And then on top of that white frosting, it almost gets a little brown. Well, guess what? That's like charred skin.
Yeah.
So you don't need that, but yeah, you get a immediate shrinking. But if you look at most of the time when we treat, you see these nice controlled little dots, and you'll see tightening. It won't be as dramatic because you're not defocusing that heat and spreading it more. But I mean, I've even showed people on like a eggplant or
Like a tongue
like a
depressor.
tongue depressor or something like that, so they can actually see that injury that they're doing. And a lot of times too, I find that when people are not good with their like block stacking, like you
hmm
said, that's when people have more injury than what's good. You can almost create a wrinkle
Yeah,
from doing too
by
much of an
missing,
overlap,
yeah,
you know?
or by missing an area, yeah. But the reality is walk before you run. Period. End of
Right,
story. And I
exactly.
think that's really hard for a provider to say, "Hey, I'm just in the beginnings of this, and we need to go." I mean, you never want anybody to be like, "Hey, I'm practicing on you." Obviously, I understand that,
Right,
but
exactly.
just realizing like, hey, this is a treatment we're going to do. And then in 3 months, we'll do this. And whether you make it a package or you make it affordable, I just think you have to understand the healing process because you can get into a lot of trouble when you have somebody that you have just blown their face up and suddenly they're not healing well and they're doing something to try and quote heal that made it worse. And, it just turns into a disaster. And probably one of the bigger things I've seen is people trying to put makeup on right away after a
The
treatment.
worst.
Actually, know of a patient whose husband was a surgeon, had some ablation done around her eyes and mouth, and then within, I think it was 6 days, decided, hey, I'm healed enough, put makeup on, and got a staph infection and some really nice scarring. So, you know,
And I mean,
that's a whole
no
other
offense, girls, but I mean, those dirty makeup brushes
gross. I know.
don't
Ugh,
help.
it's nasty.
Exactly. So, I mean, speaking of, the do's and don'ts for the first week are super crucial when it comes to a CO2. So, like you said, like no makeup, no excessive sweating and working out. Like,
Mm,
don't go to a gym. It's a breeding ground for bacteria because nobody washes their hands, and then you're going to touch your face and sweat. So, we just want, especially the first 2 days, even the first 48 hours when that skin is still like freshly ablated and open, you want to make sure that there's no bacteria, it's extra clean, and you're sticking with your basically just gentle cleanser and that little occlusive ointment that you're going to be using. Now, obviously, depending on how aggressive you go, you may need to be doing like vinegar soaks, which is like actual wound care,
hmm Yeah.
right? And that can be, I mean, multiple times a day. That could be 3, 4, 5 times a day, depending on how aggressive somebody goes.
Yeah. I actually, just for people who don't know what that is, it's just dilute. You use a tablespoon of vinegar for 8 to 16 ounces of cold water and soak little gauze pads in there and you just kind of press them on the skin. But they re-acidify the skin because when you do a ablative laser, you're actually creating more of an alkaline environment on the skin, which your skin is naturally more acidic. But it really is soothing and it's
Skin barrier, Molly, right?
exactly.
Yeah.
Um, but it's very soothing and it's antimicrobial, so it helps with preventing any kind of infection because your skin is more vulnerable at this point. You have little holes in it, let's face it. So I did that. You don't have to, but I felt good.
So, Carissa, I did want to finish up a couple things specifically about like expectations after a treatment, meaning what is somebody going to expect their skin to be like? What's happening?
Yeah. So, I mean, definitely right after you are going to feel sunburned. That's just how it is. So, when you're doing a CO2, especially, you'll be feeling a little bit sunburned. The numbing cream starts to wear off. So then you start to go, okay, it's hot. Now, I will say, again, your magician hands, I was not as hot as I have been after other non-ablative lasers. So, I found that to be really interesting. However, we did numb longer than I normally would. We used a good mask and then we used cold air. So most people
And the
that are with
exosomes.
and the
So,
exosomes, yeah, which
yeah,
to be seen. I mean, we're still
yeah,
both kind of
yeah.
like, is this real? Don't know. But I think that you can expect to feel really sunburned and that can make you feel pretty tired, just so you know. So, don't think you're gonna go shopping or do something right after. You're going home. You really want to go home. That night, I definitely felt like the swelling started to kick in. My eyes felt really kind of puffy, and I just sort of took it easy. The next day, you wake up, that is definitely the day you look the worst. You just, you're puffy. There was some pinpoint bleeding actually on my cheeks, not a lot, but some. And I definitely felt like my face had a pulse. It was kind
Yeah.
of like
Yeah.
doom, doom, which is totally normal. But then as that day went on, so this is the next day, it really just felt like sensitive. So if, my husband came over and went to give me a kiss, I'm like, "Nah,
Yeah. Don't
don't
touch me.
touch the skin. Don't
Yeah.
touch the skin." But you feel just like, okay, I'm staying inside. That said, probably by Sunday night, I really was like, wow, I do not feel bad. I just felt greasy because I had occlusive ointment all over
Yeah.
my face and neck. And it was just, it felt like you almost like sometimes if you touch, yeah, not that you're touching the area, but it almost just felt like bouncy, like swollen. That's about it.
Yeah.
After that, I'd say realistically, most people have anywhere from 4 to 7 days where your skin is really sandpapery. Normally, it just feels kind of like that. I don't want to say scabby because it's not really it. It's like you're touching an emery board
Mhm.
and it feels really tight. I will say on what was yesterday? Yesterday, I guess, was
2.
technically day 3, right? Today's Tuesday. Yes.
Yeah.
So
Day 3.
if you made the day of treatment day 1, day 3, I felt really itchy. That was the one thing that I think people don't realize happens. But as your skin starts to heal, you get that kind of itchy feeling like you would if you had like scraped your knee and it's
Mhm.
healing. So it's real hard to not want to scratch your face. So I did find that using the vinegar soaps helped that a lot. I put another mask on actually, and then it kind of was like just lightly
Kind
scratching
of like,
over the
yeah,
mask.
like,
Which is probably not recommended, but it felt so good. And then really after that, you can use a little bit of hydrocortisone cream as well with the occlusive ointment, mix it together, and the itching went away. So that was probably like the most annoying part of it. After that, though, really, I think it's just a matter of like, yeah, I'm kind of red and I look a little bit weird and I know I can't put makeup on. So you just kind of know that you have to be inside, and it's really good because I have a bunch of reading I have to get done for class I'm taking. So I just feel like I am happy to be home and forced to stay home. But I think a lot of people need to just have that understanding that they're going to feel a little funky the first couple of days because it's like having a really bad sunburn. So after that, though, I think realistically, probably by, I don't know, Thursday, Friday, which would be day 5 and 6,
yeah, 5, 6.
I think my skin is actually going to look really nice because it'll be a little bit like swollen, AKA less lines,
Right.
but also any of they call it necrotic debris, if you wanted to know
Yes.
the
Yes.
actual name, will have sloughed off and my skin will look really kind of baby fresh. So
Yeah.
that's typically from like a light to moderate treatment. Now, if it had been a really, really hardcore, treatment, that healing process would probably have an additional 5 days on top of it.
Hmm. Yeah. And I think that that's important to mention because, again, regardless of what we're doing, the worst days are those like first 2 where like the injuries are still a little bit open, where you got that pinpoint bleeding. So that's going to be the most important, I think, for the healing. But then, like you said, once you start getting that kind of itchy, dry feeling, it's super important to not scratch, keep it moisturized. If you want to use that little bit of hydrocortisone cream, it's okay. But just to make sure that people are aware that like you can get a nice result with that conservative to moderate treatment. You don't have to be doing that crazy aggressive, lots of downtime type of treatment,
Absolutely. And, I would have but I just was like, gosh, I don't have the time to have 10 days off. So I thought, all right, we'll go kind of somewhere in between, though the healing in this has been unbelievable. So let's see what
Nice.
happens the next time.
Absolutely.
We might
Now,
crank it up a notch.
exactly, which I'm all about.
I know.
Speaking of what's important, if we want to crank things up, there's certain areas you want to focus on. On social media, I see a lot of people, which drives me nuts anyway. One, with people doing things without gloves, which is just dirty. But treating eyelids without intraocular shields.
Not an option.
That's not an option for people. You should always be wearing some sort of eye protection. Your patient, more importantly, should be wearing some sort of eye protection. And then do not be treating the eyelids with an ablative laser that can go fairly deep without that metal intraocular shield.
You should never treat on top of the eyelid without internal
Mm-mm.
shields, period. Any
Yeah.
laser, but
Yeah.
especially, yes.
Right.
Because, in fact, I was with a doctor who is an oculoplastic, and thank God she was one. And she was treating her manager, and we had internal eye shields. And the first shot, boom, hit a vessel. And I mean, it bled,
Mm-hmm.
it just spurt,
Yeah.
So it's not, you are drilling deep. Now, granted, she had very thin skin, but that was, could you imagine if that was her eyeball?
Right.
So
Exactly.
the answer is we will never treat on top of the eyelid.
So that's probably one of like the craziest myths that I've ever had to correct
Yeah.
during a training, when people say, "Oh, because there's not like this big flash of light, you don't need those shields. It's safe." No, it's absolutely not safe.
No.
So that what about you? Like, have you heard something in a training that's like absolutely the craziest thing that you've heard that you've had to correct?
I mean, that's definitely one. I've seen people trying to do hair treatments with lasers that can singe hair,
Yeah.
which is not a good thing. Hair as in
I've
trying to
seen that
grow
on
hair.
Instagram too.
Yeah, me too. And one myth that it's not crazy, but it should be corrected is that these lasers can cause cancer. This is non-ionizing radiation. So it's the same amount of radiation coming out of a light bulb or out of, anything that you have. Ionizing radiation can cause cancer. That's X-rays, gamma rays, that kind of thing. But actually, specifically, the CO2 can be used to treat cancer and when it comes to cancerous lesions. And there's some research that says doing treatments the way we did one, like a light moderate, can actually prevent the progression of skin cancers. I'm not saying it cures it. I'm just saying that there are a lot of misconceptions. Now, you may or may not want to stand behind that one, but I
No,
do like to
I
tell
mean, I
people.
do see a lot more dermatologists recommending that to their patients, especially if they have a history of skin cancer,
Mhm.
to be doing them on a regular basis. Again, not these crazy aggressive treatments, but those moderate treatments to essentially remove that skin that could potentially have those cancerous cells in them. Now, that being said, and everything that we talk about in this entire podcast is never going to be recommended by any company.
This is not medical advice.
Yeah, this is not medical advice. However, from a provider standpoint, that I've heard from a lot of different people, is that's what they're recommending. There are more studies now that show that. It's the same thing with like Accutane. A lot of people used to say, don't treat if they've had Accutane in the last year. But now they're seeing that you could do 6 months, 3 months, whatever that is. I mean, I'm never going to give people specific recommendations on stuff like that, but there is so much research that's showing that things can be helpful. And like you said, you're not getting the same type of radiation from the laser versus those gamma rays or X-rays, things like that.
Right. It's visible light and or infrared, near infrared, which is what we're working with CO2. So yeah, no, it's just
Yeah.
that's probably one of the bigger myths. I think that, and it thins out your skin.
Yes.
Like,
Oh my gosh.
nope, actually does the exact opposite.
Yeah. That one, I feel like that's probably more towards patients versus like I've had to
Mhm.
correct in a training. But there's so many patients that I find that say, "Oh, I heard that it thins out your skin."
Mhm.
Yeah.
And the
It just
answer
so
is
happens that a lot of people that do the overly aggressive treatments, when they don't need them, I find that is when their skin looks kind of thin and waxy, but it's not actually thinning out the skin.
they probably had thin skin to begin with, and it may
Right.
have devolumized their fat pad for all we
Yeah.
know, because
Exactly.
heat is heat, and you go deep enough, you could absolutely do that. And we're seeing a lot of that with other devices, that some people are feeling that they got devolumization with too
Yeah.
aggressive things, which is a whole other podcast. um, no, I, as a rule, though, these lasers do not thin your skin unless you physically and intentionally burn off all of your skin and then keep going until you hit bone. Then
Right.
yes, you will thin your skin at that
Right.
point.
Now, I mean, one of the things that patients should absolutely not believe in when they hear it on social media, or not even necessarily when they hear it on social media. But again, recently I have been seeing a lot about they can do this super aggressive treatment and that's all they did. Like you said kind of earlier, usually there are other things that we do in our treatments or in a treatment plan, I should say. I actually saw from a laser company this before and after picture, and they were trying to sell a laser, and it was a before and after of this woman. I mean, don't get me wrong, she looked absolutely incredible, but it was very obvious that there were other things done, meaning she definitely had a facelift. She definitely had a blepharoplasty. She definitely had filler. So all of those things are going to play a part in kind of the structure behind the surface of your skin, which is a resurfacing laser, which is what we're talking about. But that specific treatment was an erbium laser, which also is attracted to water. So similar to a CO2. But I saw this post and I literally had to screenshot it because I was like, you cannot be telling people that this is what your device is doing. So when people, like you said, see things that are too good to be true, that one treatment is not doing that.
No,
You know,
absolutely not. I mean, I'm sure that they, in fact, did have laser resurfacing, but
I'm absolutely
the
sure.
end
Yeah.
result was not solely because of the laser resurfacing. And that's where there really has to be just honesty, like, yeah, this person needs a facelift or this person needs a bleph. However, if we make their skin better, all of the above will look so much better. So I agree. I think it's crazy. And same with skincare. I mean, I'm a huge proponent of skincare, but nothing is going to replace a laser. It
Right.
just
Right.
isn't. Nothing you do at home will be like getting Botox, or it's just fact, but they can all work together. So I think those are kind of the myths that I would love to see dispelled. And there is no one single treatment that I can do that will cover absolutely everything.
Right.
There just
Right.
isn't. If somebody has rosacea, we can't really do much with a CO2, right? But
Yeah.
we can make their skin texture better, but the
Right.
redness not going to help. So it's just setting realistic expectations, and if it seems too good to be true, like I said,
Yeah. Probably is. I do think, like I said when we started this whole thing, this is not meant to be like a training podcast, but I think it's important for everyone to get a little bit more information. I go to a lot of different practices, I know you do as well, that they always ask for additional training or where they can find additional training. Regardless of where you get it from, everyone's going to have, I don't want to say slightly different information, but slightly different information, or they say it in a different way. So I do think it's super important for providers to invest in proper training, which I always get complimented on how I train, which I appreciate. But you were the one that initially trained me on a lot of different things. So I got a lot of that knowledge from you. And I know that we have a really good network of people that we kind of always bounce ideas off of and questions off of. So I think that it's nice for providers to find those support groups, but as well as proper training. So there's different things out there, like ASLMS is an organization that does a convention every year or a conference every year, and they have different speakers and they have people that are doing clinical studies and clinical research. So it's just important for providers to get their education just as much as it is for patients to do their own due diligence, and don't just rely on what you saw on Instagram or what you saw at the doctor's office or wherever, because not everyone has the same experience.
Right. And use the knowledge you have too. Don't believe just because a rep told you it was true that it's true. And I think a lot of times that happens, especially in the laser world, because doctors want to believe it or providers want to believe it. It's like, no, well, do your research and understand the methodology behind it. And if it looks like something you think you need in your practice, bring it in by all means. But that's just the beginning. There's continuing education that goes after that. And we all do it. We all have to, even as teachers.
Yes.
Yeah.
And especially in this industry, everything is always changing.
Hmm.
Technology changes, devices change. So just staying in that wheelhouse of the same thing all the time is definitely not good. But everyone should do their due diligence.
Agreed. And nor is buying everything that comes off
Ugh,
the market.
yes. Yes. Don't
We
do
see that
either.
too. So yeah, I think it's just a matter of kind of pick a direction, figure out what it is you don't like about you. Remember, what was that from, like Nip and Tuck or Nip Tuck, whatever?
Oh,
Like,
yeah.
what don't you like about yourself? But what you don't like that is, visibly there, and what things can be done to take care of it. And then just know that it'll take a few treatments. That's the bottom line. Nothing happens overnight. So
All right. Well, that is a wrap on the very first episode of Aesthetically Speaking. Huge thanks to my friend Carissa McCormack for bringing the heat on all things CO2 and skin resurfacing. So thank you very much. And thank you so much to the listeners for joining us today. Whether you're a provider thinking about adding CO2 to your treatment menu or a patient trying to figure out if this is right for you, I hope our little conversation today gave you a little bit of a clearer picture of what CO2 is all about, what laser resurfacing is all about. And if you enjoyed today's episode, make sure you hit the subscribe button so that you never miss a future one. Also, do not forget this podcast is for you. Let me know what you want to hear next. If you have a question about this episode, if there's a treatment you're curious about, a device you've seen trending, or really just a product or topic in aesthetics that you'd like to learn more about, you can head over to my website, www.theandrewaesthetic.com. I've got blog posts breaking down some treatments, some tips, and you're also able to book with me if you're ever in the area. All right. So make sure you subscribe, and I'll catch you next time on Aesthetically Speaking.
thanks so much.
Bye.